Chuck, Gary.
Hey.
StarTalk Sports Edition. We got to do another explainer.
All right. Nice.
The time has come, and it's something none of us have any expertise in. We're going to talk about cardiac emergency, which has been all the news, especially, of course, since the incident in recent weeks of Damar Hamlin in the NFL just dropping down, needing CPR to get him off the field and take him to the hospital, leaving everyone mystified. What happened? What are they doing to him? Will it happen to me? All of the above. So we need a fast explainer on this, and we combed the world, and we found someone who's just right for this. We've got medical doctor Lipi Roy. Lipi, welcome to StarTalk Sports Edition.
Hi, everyone. It's so good to be here. Good to see you again, Neil.
Excellent. Yes, we actually just met at a separate conference, a few weeks ago, and I said, yeah, I want her for StarTalk. So thanks for this fast turnaround on your schedule. And what I particularly like about your background is not only that you are a physician of internal medicine, but anybody could be that. You're also a master's in public health, and public health has been so much in the news throughout COVID, throughout anything else that we're all trying to do in a society. And so the combination of your medical doctor's background and your public health background, I find to be completely ideal for so many questions that we have. And I just want to let people know that you're a frequent commenter on MSNBC, NBC, and for Forbes, and you've got a YouTube show. And let me get the name of that right: Health, Humor, and Harmony. Ooh,
nice.
3 H's. I see what you did there.
Yeah, so sounds like a rap group from Compton. Sounds like a Compton rap group that's a lot more positive.
Oh yeah,
it's not Bone Thugs.
I'm not that cool
Humor
though.
And harmony.
That's right. I wish I was that cool. I'm not as cool as you, Chuck. No way.
All right. So Lipi, in the few minutes that we have for this explainer, could you sort of unpack clinically the difference between cardiac arrest, a heart attack, and heart failure? Is there a difference? I know most of us use them interchangeably, but it seems to me that they're not all the same when you're coming from where you stand.
Yeah. So first of all, thank you so much, Neil, for having me on your show. I'm so glad to be here. This is a topic that's so important to me. As an internal medicine physician, I actually have cared for many, many patients with all forms of heart disease. I was telling Chuck and your producer Gary earlier that personally, I'm affected by this. My own father had a heart attack 20 years ago and is now struggling with consequences or complications such as heart failure. So this is a really important topic. And you're right, Neil, these terms are used interchangeably, but they mean different things. And before I start, because humor matters to me, and then Chuck is going to care about this, I want to start with a silly joke. Why did the patient refuse a much needed cardiac transplant?
Oh, that's easy, because he lived in America and we don't have good health care.
So that's the real reason. But the joke reason is that he had a change of heart.
No.
All right. So I know, Chuck, you can totally criticize that from a comedian standpoint.
Oh, there's no need.
So Neil asked, cardiac arrest. We all know that NFL safety Buffalo Bills player Damar Hamlin experienced a sudden cardiac arrest on the field. That simply means that your heart abruptly stops pumping, and so that the lack of blood flow to the brain and other vital organs, and without immediate medical attention, specifically CPR and defibrillation, the person will lose consciousness, become disabled, and could die. So then what's heart attack? A heart attack is when the blood vessels that supply the heart, which are called coronary arteries, when those blood vessels get blocked, either from like a cholesterol plaque or a clot, that clogged artery can no longer supply much needed blood to that part of the heart. And if it's for a short time, then that's ischemia, which means low oxygen to that part of the heart. But if it's prolonged period of no blood flow to that part of the heart, then that's called infarction, or MI is myocardial infarction, which is the technical term for a heart attack. And a heart attack, by the way, is a leading cause of cardiac arrest. And then Neil asked about heart failure. So heart failure really means that your heart just is not pumping sufficiently, or it's not filling with blood appropriately. And as a result, vital parts of your vital organs like your brain and other organs aren't getting sufficient blood. And so heart failure is the leading cause of heart failure actually is coronary artery disease.
Okay, so heart failure is something that the heart is not living up to its specs, is what's happening there. And of course, there will be consequences to that. So what actually happened to Damlin?
So great question. So we know, by the way, let me just also as a disclaimer say I've never personally treated him. So I don't know. I don't have access to his actual medical records. But however, there's been enough
I
information.
thought you meant you never treated him before the event. I was like, covering your ass there, huh?
No, that's
oh yeah. Never before, now, after. Let me just also share. I don't know if your listeners know this, but he has just been released from Buffalo General Hospital. He is now discharged home. I cannot begin to tell you what an absolute miracle this is, because statistically, 9 out of 10 cardiac arrests that happen in the field have an adverse and actually fatal outcome. So the fact that he's alive is because of 2 reasons. One, he had immediate chest compressions and fibrillation, or that defibrillator, the AED, and the fact that he's a young and otherwise completely healthy guy. That's what worked in his favor. But Neil, he had Damar Hamlin experience a sudden cardiac arrest on the field. We speculate it's because that tackle triggered what was called commodio cordis, which is again a fancy word to say basically an agitation of the heart. So the timing of that collision happened at a cycle of the electrical impulse, so that it caused a disruption and the heart just stopped. That's all that we know. Beyond that, there could be other information, but the hospital hasn't really disclosed. But that's what we know so far in terms of his cardiac arrest.
So it's kind of like if you're at a party and somebody not bumps into the DJ table and the record skips, but kicks the plug out of the wall and the music stops.
That's a great metaphor.
It's exactly like that.
Yeah. So doctor, there's another term I hear called blunt force trauma, which would describe an NFL tackle. So when you've got this event that happens tragically, what are the primary care must-dos for the first responders who get there, assess, decide what treatment is required, what are they thinking? What is their primary must-dos in this event? Because this is what's really saved his life.
Well, if there's any kind of positive out of this event, look, I'm sad that this happened to Damar, but I'm really glad that he's doing well. But what it really did is bring really national, if not global, attention to CPR, or really BLS, which is basic life support. Yeah. Everybody and their mother should be trained in basic life support, because you never know when somebody's going to collapse. Do you think anyone expected this elite 24-year-old athlete to just collapse like that? So, but this could happen in your house, on the sidewalk. Everybody needs to know CPR. The training is free. You can go to First Aid, American Heart Association, and get that training. So Gary, that's excellent. One thing. Learning CPR is life-saving. You do not have to have the letters MD behind your name to do that. And you could be 10 years old. You can be 89 years old to learn CPR. A. B, have AEDs, automated external defibrillators, nearby. I don't know if every house should have it, but if you live with people that are at higher risk for having heart disease, heart attack, sudden collapse, stroke, get an AED and know how to operate it. Operating is actually really simple. You literally press the on button and then it tells you what to do. So those 2 basic strategies, Gary, are going to be key. But really, BLS will teach you, check for a pulse. Are they responsive? Are they breathing? Those are the basic things, Gary.
So as a positive, Neil, the defibrillator, my father had a heart attack on a transatlantic flight, and the cabin crew pulled out a defibrillator and brought him back. So to talk to the doctors, that's the experience at my personal level of understanding exactly why that is so necessary. So, I mean, I look, Neil, at, yes, we've got a young athlete, a professional athlete whose life is not more important than someone else's life, but the focus of attention and media is there. Imagine now what it must be like to be the chief physician, the first responder, the person responsible. Doctor, please, because not everybody looks at it from this point of view. What goes through the mind of someone who is charged, pun intended, bad one, with bringing this man back to a safe and healthy place?
So look, at the end of the day, we're trained professionals. This is what we're trained to do. It's to save lives at the one extreme, but really improve the quality of life. That said, I'm sure that there were many of trainers that were just a few feet away. So that's another major reason why he had this positive outcome. But yeah, it's nerve-wracking. I've been in ICUs, CCUs, emergency departments. I've been in homeless shelters, working in clinics.
Wait, what is a
people have
CCU?
collapsed.
What is a CCU?
Coronary cardiac care unit, and ICU intensive care unit. So CCU is just specifically for cardiac patients that are critically ill. Yeah, my father, brother have all been in CCUs. I've rotated through CCUs. I also trained at Duke, which is a major cardiac center and a place where people go to train in cardiology. So, but it can be very nerve-wracking, even for healthcare professionals, Gary. As a doctor, even I get nervous. But your adrenaline and epinephrine's pumping up so high that you just act. The impact that this had emotionally and psychologically and on the teammates,
culturally,
on the family members,
the whole
and even
landscape.
culturally. It's totally shocking. But this is why I'm glad we're having this conversation, because just so your viewers all understand, heart disease is still the number one killer of people in the United States and globally. Number one. But the good news is we know how to prevent it. So that's why I'm glad we're having this conversation.
No one's going to take the steps.
So Doctor, because we don't know the case specifics for Damar Hamlin, there is a condition, and I'll probably mangle it. It's hypertrophic cardiomyopathy, which is a gene mutation, I believe, that we have seen athletes all of a sudden just drop down dead once they're in an athletic event, or they just finish and bang, something goes completely wrong. Am I right that 85% of the people who have this condition go undiagnosed?
Yeah, so I want to make sure we're not conflating issues. So when an athlete can, you're right, collapse, but there can be multiple reasons for that. Hypertrophic cardiomyopathy, pretty much as the name explains, hypertrophic just means enlarged, big, cardio, heart, and myopathy is really any type of dysfunction or weakness of the muscle. So in HCM, let's just call it that, the heart muscle gets really enlarged. And as you pointed out, Gary, most of the cause for it is genetic. And the heart, the muscle, particularly that left ventricle, which is the one that pumps, is a pretty muscular part of the heart chamber. In HCM, the walls, the septum, which separates the left and right ventricle, that wall and the left ventricle, the walls get really thick. Again, there are actually over 30 genes that are involved and hundreds of mutations within those, I think 15 genes that are involved. But hypertrophic cardiomyopathy can lead to a cardiac arrest because it can be associated with fatal arrhythmias like VFib or VTAC, ventricular fibrillation attack.
How do we diagnose it? How do we know in advance so that you don't put them out on the field and die?
Yeah, great question. So basically what you're asking is, so how do you screen for HCM? The thing is that HCM is actually really rare. 1 in 500 or maybe 600,000 to maybe about 1 million people in America have HCM. Yeah, there's an important thing to remember is very, very few people with HCM actually get sudden cardiac arrest, maybe 1%. Okay, so it's a very, very rare event. Most people can live long and healthy lives. But screening, I actually don't know if all professional athletes get screened for it, but the most common ways to screen for HCM are through an EKG, which is an electrocardiogram. You put electrodes on the chest, or an echocardiogram, which is or TTE, which is really an ultrasound of the heart.
Oh, got it. And so I have a statistical question because we got to wrap very soon. In American football, people are tackled all the time in their chest. This is not a rare thing. And in fact, everyone who saw that tackle said that was a normal tackle. So if there's the risk of this pressure on the chest happening at the exact wrong time in the heartbeat cycle, why doesn't this happen way more often in this game?
The short answer to that, Neil, is that we don't know, but I will tell you.
Oh, good. I like that.
But
great. Look, great. That's very honest.
But statistically, this is really a rare event. To your point, Neil, these collisions happen all the time. It is the core of the game. And yet, unlike some of these other conspiracy theorists who will say that, oh, this cardiac arrest, these athletes are dropping like flies, and they're associating it with the COVID vaccine, which is totally false. There is no connection. We don't really know, but it's truly a rare situation. So the commotio cordis, that sudden agitation of the heart, the sudden cardiac arrest are extremely rare events. Look, I'm a big fan of hockey. Hockey collisions happen all the time. Do they all drop like flies and they have cardiac arrest? No, they don't. So it was really a rare fluke event. These athletes are otherwise extremely healthy people. So now, do these professional organizations need to do more screening? I don't really know. But again, it's really, really rare. Yeah.
So we've had it in my version of football, Neil. We've had players collapse in the middle of a game, but greatly. There's two famous ones. Denmark's Christian Eriksen and an English football player called Fabrice Mwamba. And a cardio specialist walked out of the stand, treated him there and then, saved his life.
That's without getting hit, right? They just collapse.
There's no collision. This just is a collapse.
Right.
So the public attention, the consciousness of this now being an issue, albeit quite rare.
Like Lipi said, it takes that to raise public consciousness.
Sadly, it does, but hopefully there'll be a positivity comes from this tragic event,
right?
And people are aware.
Hopefully, the positivity is that people will take better care to learn more about how to prevent it for themselves, because heart disease is the number one killer, and as you get older, things like congestive heart failure and heart attack are very, very common. And when you take care of yourself through all the crap we say, your proper diet, exercise, all this stuff that nobody wants to hear, you're extending your life. You really are. It's that simple.
Ending on up notes here. So very excellent. Libby, a delight to have you here. And the fact that you are active in public health makes you one of society's heroes. And I just tip my hat to your entire career of what you've done for homeless people and people in prison, just the general health conditions of people who need it most, and all that you think and all that you do and all that you've shared with the public. Just keep at it. And we're going to come back to you for more, for sure.
Yay.
I'm thrilled to hear this. Can I just say quickly, the three biggest risk factors to decrease a person's risk for heart disease? It's high blood pressure, high cholesterol, smoking. Get those under control. You will decrease your risk of getting heart disease, heart attack, and maybe even a cardiac arrest. I'm so happy to be here with you guys. You guys are so great, funny, smart. I'm so honored to be on your show.
All right, we got it. That's all the time we have. Libby, it's great to have you. And of course, Chuck and Gary.
Not so great to have us.
No,
not you guys.
It's a pleasure. No.
This has been a StarTalk Sports Edition explainer. What's going on with our heart? I'm Neil deGrasse Tyson, your personal astrophysicist. Keep working out.